So, good day, sir. I am Althea Vanessa from BSN-1B, and for today, I'll be performing the assessment of the mouth and oropharynx. So, the definition of the mouth and oropharynx is that it is composed of the lips, the oral mucosa, the teeth, the gums, the tongue, and the trachea. And the purpose of the assessment is that it will help us identify for if the patient's mouth and oropharynx is well or there are any underlying issues with the mouth and the oropharynx. So the materials that we're going to use for this procedure are the gloves. It can be sterile or disposable gloves. And then we have the tongue depressor. We also have a tissue, and a pen light, and a 2x2 gauze. The first procedure is to wash our hands, so let's just assume that we are done washing our hands. Then now, we're going to wear the disposable. So now we're going to start with the procedure. The first procedure is to explain the client the procedure and provide privacy for the client. So if the room has curtains, then we will cover the windows with curtains or lock the door. So, sir, I will explain to you the procedure. Today I will be assessing your mouth and your oropharynx. Do you give consent to this? So our client has already given consent. The first and then the next procedure will be we're going to inspect for the outer lip of the client, check its symmetry and contour, and the color and the texture of the outer lips. So for this assessment, we're going to ask the client to protrude his lips as if he is whistling. So the client's outer lips is normal. Then now we're going to check for the inner lip and the buccal mucosa to check the color, the texture, the moisture, and the presence of lesion in the patient's mouth. So, after the inner lip is now we're going to check for the teeth and gums. So using a pen we're going to check if the teeth has oral cavity and the gums has bleedings or inflammation, and mouth sores and any other unusual presence in the teeth. So, if the patient has dentures, then we will ask the patient to remove the dentures. But if there are no dentures, then we can skip that part. Then after is we're going to check for the tongue and the floor of the mouth of the patient. So first thing to do is we're going to inspect the surface of the tongue, and we're going to ask the client to protrude his tongue for this assessment. So, pwede nyo i-iwan ito. We're going to check for the color and texture of the tongue. Then next is we're going to inspect the tongue's movement, to check its movement. So we'll ask the client to roll his tongue up and move it side by side. So we roll it. After that is we're going to inspect for the base of the tongue, the floor of the mouth, and the frenulum of the tongue. So we're going to check for its color again and its texture. We're going to ask the client to put the tip of his tongue in the roof of his mouth. After that is we're going to palpate the tongue and the floor of the mouth. This is to check if there are any lumps or nodules in the base of the tongue. So for this procedure, we're going to use a 2x2 gauze to grasp the tongue, and with our other hand, using the index finger, we're going to palpate the sides of the mouth and the tongue and the floor of the mouth. The base of the mouth of the patient, as I have palpated, there are no lesions and lumps. So we're going to proceed with assessing the salivary glands. So we're going to inspect the salivary ducts and openings if there's any presence of swelling, or redness. Then after that is we're going to inspect for the palate and the uvula of our client. So first we're going to inspect the palate, the hard and the soft palate. We're going to use with this procedure, we're going to use a tongue depressor and a pen light for better illumination. And we're going to ask the patient to tilt his head back and open his mouth wide so that we can check for the color, texture, and shape and the bony prominences of the hard and the soft palate. Then after that is we're going to check for we're going to check the uvula, the mobility and the color of the uvula of our patient. So we're going to ask him to say a soft ah so that we can see that the soft palate is rising. After that is we're going to assess for the oropharynx and the tonsils of our patient. So in assessing for the oropharynx, we're going to check the texture and the color. And in assessing as well, we have to do it one at a time so that we can avoid eliciting the gag reflex. And in inspecting, we're going to expose one side of the oropharynx while the tongue blade is pressed against the tongue on the same side, and still the patient is tilting his head back and his mouth is open wide. And we're also going to use a pen light for better illumination. Then after that is we're going to check for the tonsils of the patient, the size, the shape, and if there are any discoloration. So we're also going to use a pen light. So the tonsils of our client is normal. Now we're going to elicit the gag reflex. By doing so, we're going to use the tongue depressor again, and we're going to press the tongue blade into the posterior procedure as well. We're going to ask consent again from the client because this could cause sudden reaction or trauma to the client. After all the procedure is done, then we're going to document the results and any unusual findings as during the assessment of mouth and oropharynx. And that would be all for my performance. Thank you.